Thank you everyone for joining us today. This is our community workshop number 4, budget transparency, in response to the request to have more information regarding a budget overview and what we will be looking for here at MOLTCO. My name is Aria Mormon. I use she, her pronouns, and I'm the project manager for our community services RFPQ for the Aging, Disabilities, and Veterans Services Division. We are so excited to have all of our subject matter experts here today. And we are going to go ahead and give a quick introduction of who we are, what our pronouns are, and what our title is. Starting with Jacob Messman.
Hi, my name is Jacob Messman, and I use he and him pronouns, and I'm a Quality and Business Services Manager with Aging, Disability, and Veterans Services Division.
Hi, everyone. My name is Lynn Schemmer-Valou. I use she, her pronouns, and I'm a program manager with Multnomah County Aging, Disability, and Veterans Services on the Community Services team.
Hello, my name is Margreta Hansen. I use she, her pronouns. I am a program supervisor in Aging, Disability, Veterans Services in Community Services.
And welcome everyone. I am Marina Kalina. I use she and her pronouns, and I'm a senior program manager for the Community Services program at Aging, Disability, and Veterans Services Division.
And thank you for joining us, everyone. My name is Tanisi. I'm an office assistant and I use she, her pronouns, and I'm at the MOLTCO Aging, Disability, and Veterans Services Division. Thank you.
Wonderful. And at this time, we're going to go ahead and give you a quick agenda overview of what it is we will be talking about today. Today, we will go ahead and give you an overview of our key presentation terms. We will discuss the RFPQ background, contracts evolution, and then we will dive into setting a rate, which involves contract negotiations, supplier counts, current rates, match, and subsidy. Then we will transition into administrative capacity needs, discussing funding types, service categories, including the district centers, enhancing equity, nutrition services, evidence-based health promotion. And then we will wrap it up with consumer access, talking about wait lists and general county fund supplementing. How fun. And we will also provide to you the email that you can reach out to us to let us know any follow-up questions and answers that you may have following this presentation. The following are the key terms for today's presentation. Request for proposal, otherwise known as RFPQ, is the request for programmatic qualifications. And my apologies for saying request for proposal. It automatically is the first thing that comes to brain. But also Community Services Mega RFPQ, which is our nickname for the funding event, otherwise known as Community Services for Older Adults. People with disabilities. For the purposes of our funding, this refers to adults who are considered disabled. OPI, Oregon Project Independence. OPI provides limited in-home services to people who need a little help to continue living independently in their own homes. Service program is provided by suppliers involving case management of consumers. OAA, otherwise known as the Older Americans Act, funding for the request for programmatic qualifications, as well as a subsidy, which is funding amount to be paid by the supplier based on negotiated contracted rates. Administrative costs, funding amount, which is 15%, to be managed by the supplier for associated costs. The remaining funding, 85%, to be allocated towards services. And match, the contractor's contribution is in addition to the total allocated amount for services. To provide an overview of our community services RFPQ background, We established a project charter, and that was in 2020, with the goal to simplify the RFPQ application process to ensure that funding is fully expended each fiscal year. And a major philosophy of the OAA is that preventative and supportive services that help older people to maintain their independence should be available to all older persons and their families. We intend to address this by having a robust engagement in the different service areas, which will be overviewed later within this presentation. The ADVSD philosophy is that policies, programs, and services are established in response to the needs and expectations of participants. The services provided through the district centers and enhanced equity partners are determined by the ADVSD system priorities and defined in the area plan. Our guiding principles involve maintaining a regional and culturally specific approach to service delivery, maintaining the major service areas, maintaining commitment to funding culturally specific services. And these services are to be participant-centered and participant-driven. And next, we will provide an overview of how we have evolved to this point. I will pass it off to Lynn.
Thanks, Aria. So this is a snapshot overview of the evolution of our RFPQ process. Our work unit has a long history of partnering with community-based organizations to provide local neighborhood-based services to older adults and family caregivers, including a pilot to direct some of our funding in contracts to culturally specific agencies, which started back in 2011. This pilot proved to be very successful, which led us to direct a more significant allocation of our funding to culturally specific organizations in our 2017 procurement. District senior centers, which provide Older Americans Act services, Oregon Project Independence case management, and evidence-based health promotion, and nutrition services, and then also our culturally specific services, which historically in 2011, which was about 10% of our budget. Our culturally specific services expanded in 2017 to be about 38% of our budget, including a wider array of services that they could select to provide to their cultural community. District senior centers continue to provide the full array of services serving their specific area of Multnomah County. In 2018, contracts were executed for culturally specific services and culturally responsive organizations. In 2022, our district senior centers continue to serve as community focal points. Enhancing equity contractors focus on the cultural, racial, or ethnic specific groups. Looking forward in 2014, we hope to improve and expand these contracts with a focus with the equity lens applied and reducing barriers and leading with race. I want to move now into information about setting your rate. How to set the rate. Things to consider when engaging with Multnomah County during contract negotiations and when you're thinking about your rate for each service category. Think about your staff salaries, including benefits, taxes, workers' comp insurance, things like that. Think about the type of employee and the job classification that is needed to do the work and your agency's salary structure for that classification. Another consideration is around productivity for those positions. We'll discuss service goals and for serving your community. We'll be doing that during contract negotiations. This will also include a target goal for the number of people supported for different services and programs such as nutrition, evidence-based health promotion, or OPI case management. We know the demand for those supports will exceed our annual funding if no additional financial resources are available. For some services, you will maintain wait lists when allowable. And for some services, you will need to continue to serve the clients even if your agency runs out of funds that is in your service contract. Those units will be billed as subsidy on your invoice. We will monitor the level of service support that you are sustaining throughout the fiscal year and the number of people who are waiting. This will help inform additional support you may need and future planning. These are fee-for-service contracts, not cost reimbursement contracts. Productivity means how much of the work being done is a billable unit of service and how much of the work is not billable units. Meetings the person might be attending, not serving the client, not a billable unit of service, not answering the phones, not billable units for information and referral, for example. Think about days off and vacation and sick time. Time the person is not at work is not a billable unit of service. So that's what we mean by thinking about the productivity for each position that will be part of these contracts and providing services. Another consideration is admin or overhead. Think about the service you contract to provide. For example, case management. Consider the cost of hiring, training, and retaining a case manager in your agency. Also think about other aspects that are part of hiring an employee. Typical items listed as general and administrative expenses may include space or office rental space, utilities, employee benefits like insurance, managers' wages and benefits, depreciation of office fixtures and equipment, legal counsel, accounting staff salaries, office supplies. So factor in literally, oh my gosh, so factor in literally all of these things that you will need to consider when you're thinking about your rate. Sorry, I've lost my space in my notes here. Consider, oh gosh, the resulting in this calculation may be a range of cost based on the size of the caseload. Some case managers may spend 30% of their time supporting OPI. Others may spend 75% of their time. Consider both of these scenarios and propose a range of rates. And so this is what we will be doing in that contract negotiation and your rate, those conversations that we will be having with agencies that are part of our qualified pool of agencies. We're going to negotiate your rate and talk about our county budget that is available and considering the goals for serving your community. Our next slide, we're going to be talking now about supplier selection, funding allocation, and contracts. So as I mentioned earlier, from our pool of qualified providers, we will engage in service and rate negotiations. In the previous slide, we discussed your process for proposing your rates. We will then engage with your agency to do final negotiations. This rate negotiation will also include discussions about service levels, types of services your agency would like to provide, and what Multnomah County is willing and able to provide funding for. So thinking ahead, and let's talk a little bit about how we do the allocations for funding. Again, from our pool of qualified providers, and after we have rates determined and the types of services that your agency wants to provide, we can then look across the board at all agencies that we're considering and the services and start to determine how much we can allocate for which service and to which agencies. Considerations may include organization size and readiness. Is your agency ready to start providing these types of services? Also, what services have all of the agencies applied for? And then our administrative plan to begin implementation, particularly if your agency is a new contractor to us or new to providing certain services. So again, more about setting your rates and current rates overview. So let's talk about currently what the rates are for different types of services. So each agency's rates range and vary depending on size, volume of services provided, and different types of classifications providing the different services. For information and referral, rates typically range about $30 per unit. We also work with agencies that provide calls that take longer than 30 minutes as part of the information and referral network. And those rates range from $50 to $60 a unit. For case management service, and this would include OPI case management, options counseling, family caregiver support case management, and Older Americans Act case management, the rates vary from about $55 a unit to $66 a unit. And then for the nutrition programs, home delivered meals, the range of about $11.75, somewhere around there for home delivered meals, and about $17 to $25 for congregate meals. And so these are considerations for you to be thinking about as you're planning for your contract and your rate negotiation. So Marina and I are now going to talk a little bit about match and subsidy. And I can start us off by talking about match. So all contractors providing services under this RFPQ will be required to provide some level of match in their budget, about 10%. This match is the contractor's contribution and is in addition to the total allocated amount for services. The entire match must be for services awarded through this procurement and can be generated from the following ways: donated supplies, work performed by volunteers or interns, and we use the current 2021 volunteer rate for Oregon as recognized by the independent sector, and that amount is $29.75 per hour. Donated professional services or programming, and cash match from fundraising or other grant sources that your agency has secured that directly support the contracted services. And I'll pass it off to Marina.
Thank you, Lynn. I will continue to talk about the subsidy. Contractors may provide more services than can be reimbursed from their county allocation, and in some cases may be required to. We request that contractors show additional service units provided without reimbursement as subsidy on their invoices. And what is the subsidies? One of the categories, service rate subsidy, for example, case management. You provide $100 of cost to provide service unit. So Maltco can pay $60 per unit, and supplier as a contractor pays $40 per unit. So reimbursement for subsidy depends on the availability of funds that can be used for the specific services and ADVSD's determination of the best use of these funds to benefit the community. Subsidy that cannot be reimbursed includes subsidy used to meet the match requirement, subsidy where the contractor used federal funds to provide the service, subsidy in any situation where reimbursement would result in contractor being paid twice for the same service, subsidy of the unit rate by the contractor. ADBSD will not reimburse subsidy for services that are paid by monthly allotment, such as focal point, transportation scheduling, and coordination. And I will pass it back to Lynn.
Thank you, Marina. I think we're transitioning now to talking about our budget overview. And Jacob.
Thank you, Lynn. There is approximately $7.2 million a year in contracts that are part of the RFPQ. Approximately 1.7 million is allocated to the Medicaid Family Caregiver Assistance Program and the Medicaid Organ Project Independence Program. There is approximately $2.9 million of county general funds. These funds are used to provide services across the provider network by supplementing the Older Americans Act funding. There's approximately $38,000 in Title III-D, Health Promotion and Disease Prevention. These funds are used for chronic disease prevention, disease management, and education. There is approximately $245,000 in Title III-B, Supportive Services. These funds are used for supportive services such as legal assistance, information and assistance, case management, adult daycare, adult day health, home delivered meals, interpretation and translation services, options counseling, and other supportive services. There's approximately $565,000 in Title III-C1 for congregate meals. There's approximately $596,000 in Title III-C2 for home delivered meals. There is about $183,000 in Title III-E Family Caregiver Services. These funds are used for caregiver access, information for caregivers, and caregiver support groups. There is approximately $360,000 in Nutrition Supplemental Income Program, or NSIP, that are funds that are used to provide meals through nutrition programs. There's approximately $318,000 for Organ Project Independence. These funds are used for personal care needs, home care services, and case management, as well as other services to help older adults remain independent. And lastly, there's $116,000 in Medicaid services or Medicaid funding that's used for information and referral services. And Lynn, I'll pass it back to you.
Thanks, Jacob. Let's talk a little bit more in detail about the different service categories. These are the service categories that are described in detail in our program model, which can be found as part of the RFPQ as well as on our RFPQ webpage for Aging, Disability, and Veteran Services. Based on your contract, these items will be part of your allocation for services. Within these broad categories are further more detailed services underneath. Each of those more specific categories will be funded by a single source or a mix of funding sources that Jacob described on the previous slide. So this first service category, focal point for older adults. Older Americans Act and the services provided. So focal point funding is part of our Older Americans Act funding. Within the Older Americans Act, there is mention of community focal point for older adults. These are the different categories and funding buckets that Jacob described earlier. In the Older Americans Act, they talk about community focal points for older adults. A collection and collaboration of services for older adults, which may include information and referral, advocacy, meals, health and welfare, transportation, elder abuse prevention, caregiver support, in-home care, and adult daycare. And within our funding model, we have a category called focal point funding. This funding is not fee for service, but rather an annual allocation that your agency will draw down each month in a 1/12 split. Focal point funding in contracts is for all of the events, activities, support that your agency offers as a hub for older adults and family caregivers. This includes recreation, volunteer services, reassurance services, support groups, advocacy events, and other activities that your agency may host. I'm going to hand it off to Emily now, who's going to talk about information and referral funding.
Thank you, Lynn. The information referral services recognize the inquirer's right to accurate, comprehensive, and unbiased information provided in a confidential or anonymous manner. And right now, as Lynn spoke before, the rates range from $15 to $60 an hour, depending on the service delivery, the duration of the contact, the complexity of the call. Information are contacts made by a consumer that may just be looking for information only. A short, quick summary of providing them with detailed information, and they are able to make consumer choice and make follow-up calls with themselves. Referral and assistance, that is where we are spending more time assessing the caller for community resources, community-based services. Also through that, we are required to ask all of the Real D SOGI demographic information, and that needs to be entered into GetCare. To receive the referral and assistance rate, you need to have all of the Real D and SOGI information entered into GetCare. Staff will receive ongoing training and ongoing support from Multnomah County and the statewide ADRC team. Currently, we have a pilot where we are allowing partners who are experiencing callers who are needing a secondary assistance and spending more than 30 minutes a call, we are able to provide with further financial assistance, and that would be decided in the RFPQ. Thank you.
Now let's move to talking about case management and all of the different things listed underneath case management. So for any and all of the case management services that your agency provides, you will have one case management rate. This rate will have factored in and included all of the things that we discussed earlier, including admin and overhead for that position or positions that are providing any type of case management. Case management is paid for by fee for service. Each month you will report units of service provided and your rate will be applied per unit of service. Your invoice will be verified that the clients were served and units of service are accounted for. Older Americans Act, or OAA, case management is funded using Older Americans Act funding. OPI, or Oregon Project Independence, case management is funded with state funding for that statewide program. Options counseling is primarily funded with county general fund. The Family Caregiver Support Program case management is funded with 3E Older Americans Act funds with some county general fund also. The next category we're going to talk about is evidence-based health promotion funding. Evidence-based health promotion funding We receive Older Americans Act fund under Title III, and we are required to spend those funds on evidence-based programs that have been proven to improve health and well-being and reduce disease and injury. The annual budget for evidence-based health promotion courses is funded in part with the federal funds, 3D funding, and supplemented with some county general fund. The evidence-based health promotion model includes an expectation that community partners who offer these courses will include in-kind donations, staff coordination, hiring of certified instructors, advertising for the classes, finding class space, taking attendance, and inputting the data into Compass, the statewide database. The current annual budget is about $72,000. The specific courses that we fund include different tiers, tier 1 and T2. Tier 2, we provide funding for chronic disease self-management and the different programs that are part of that CDSMP chronic disease self-management program suite of services. We provide funding for Tai Chi, Moving for Better Balance, Arthritis Foundation exercise program, diabetes prevention program, Walk with Ease, and the Aging Mastery class. So we have 2 tiers of established rates that we will pay for completed courses. Tier 1 is a class that is typically provided in English and at your own location. You're not paying rental fees. And Tier 2 is a higher rate that we are able to pay for classes that might be provided in a language other than English, and where you might be using some off-site space that requires some rental fees. There's other considerations that we can discuss to determine if your agency qualifies to receive Tier 2 funding. The ranges, the fees range for chronic disease self-management, $4,592 completed for a Tier 1 class, and Tier 2 is $5,096. For the Tai Chi Moving for Better Balance, $4,592 for Tier 1 completion, and Tier 2, $5,096. Tai Chi for Arthritis Foundation exercise program, $1,254.40 for Tier 1 and $1,400 for Tier 2. The diabetes prevention program, $4,592 for Tier 1, and Tier 2 is $5,096. Walk with Ease, Tier 1, $756 and $840 for Tier 2. The Aging Mastery class, we would pay Tier 1, $4,592, and Tier 2, $5,096.
Thank you so much, everyone, for providing such a robust overview of our budget and our intention to, ensure that we are transparent in what we are allocating as well as how we are allocating these funds. We do ask that you participate in our brief survey to provide feedback of the information that was provided today, which can be found in the bio summary. And at this time, we want to make sure to say thank you all for taking the time to review our budget transparency session. We are so excited to have so many new community and returning community partners submit proposals. And we do have more information around how you can contact us. This is our email for your review and submitting questions and answers. We look forward to engaging with you all. Thank you so much for your time today.